Several years ago, the VA implemented a program to decrease the risk of Clostridium difficile infection, or CDI, in our veterans. As you play an important role in preventing the spread of C. diff, the VA requires you receive annual training on this topic. So let's start by talking about what is C. diff. The average human digestive tract is home to as many as 1,000 different types of microorganisms or germs. Most of them are harmless, or even helpful under normal circumstances. But when something upsets the balance of these germs in your gut, such as taking an antibiotic, otherwise harmless bacteria can grow out of control and make you sick. One of the worst offenders is a germ called C. difficile, or C. diff. As the C. diff germ overgrows, they release toxins that attack the lining of the intestines and cause diarrhea. Severe cases may need intensive care or even surgery. The most severe cases can result in death. How do patients get C. diff? C. diff is found in the stool and makes spores, like very tiny seeds, that can live outside the human body for a long time. When a patient has diarrhea, the spores can easily get on bathroom fixtures, bed rails, linens, and other medical equipment in the room. These spores cannot be killed by most hospital-grade disinfectants. If we don't follow isolation practices, we can get these germs on our hands and clothing and spread C. diff to other high-risk patients. If these patients get the spores on their hands and swallow them, they might get sick. Who is at risk for getting C. diff? Anyone taking antibiotics or drugs to decrease stomach acid, hospitalized patients or nursing home residents, and the elderly. Patients with bowel surgery or procedures or other serious illnesses. Also patients with previous C. diff infection. What can be done to stop the spread of C. diff? Patients with C. diff are placed on isolation precautions. A tan sign is placed on the door. It provides instructions on what to do when you enter the room. All staff, including housekeepers, must gown and glove when you enter the room and go beyond the red line. Trash cans are considered contaminated and should be kept beyond the red line. Therefore, you must wear gowns and gloves when you remove trash from these rooms. After removing the gown and gloves, you must wash your hands with soap and water. Alcohol hand sanitizers will not kill the C. diff spores. Hospital rooms and equipment of C. diff patients require special cleaning. You should clean and disinfect high-touch surfaces daily. This includes areas such as the light switches, sinks, doorknobs, and overbed table surfaces that can be wiped without moving patient items. It is very important to clean these surfaces to decrease the amount of spores in the environment. You must also use a bleach-based product to kill spores. Surfaces must remain wet with the product per the manufacturer's instructions. Follow the facility SOP for terminal cleaning when the patient is discharged. The last step in the process before releasing the room for the next patient is to use the Zapper UV light to kill any spores left in the environment. Monitoring and feedback to EMS staff. One final part of the VA prevention program requires there be monitoring and feedback to EMS staff regarding cleaning. Results of the monitoring are also reported to the Infection Control Committee. If you have questions regarding this, please call me at extension 54060. And again, thank you for all you do to prevent the spread of infection.